For the first address, it is my honor to introduce a distinguished guest, President of the Nepal Association of Urological Surgeons, Dr. Mahesh Bahadur Adhikari.
Good evening, respected dignitaries on the dais, faculties, delegates, ladies and gentlemen. First of all, I would like to thank the SAUS and the SLAUS for inviting me to this great meeting in Colombo. I attended the meeting the whole day today, and I had a great opportunity to learn from one of the world authorities in urology. And the whole program the scientific content was very, very good, and then it is all evidence-based. Ever since, I was watching cricket match in 96 when Sri Lanka lifted the World Cup. And then ever since, I wanted to visit Sri Lanka. And this SAUS meeting gave me a good opportunity to visit Sri Lanka. So I'm very impressed by the academic sessions and the great hospitality extended to us. The South Asian Urological Society actually has given us a big platform to showcase our skills and knowledge in the international frontier. So I would like to thank all the organizing committee once again for inviting us, and I wish a great success of this meeting. Thank you very much.
Please join me in welcoming Professor A.K.M. Khurshidul Alam, the President of the Bangladesh Association of Urological Surgeons.
Ladies and gentlemen, distinguished guests, esteemed colleagues, I stand here before you today as the President of Bangladesh Association of Urological Surgeons, addressing this august gathering of urologists from across the SAARC countries and beyond. I extend my deepest gratitude to the organizers for orchestrating this significant event and to the Sri Lankan Urological Association for hosting the SAUS conference. Our coming together here is not merely a symbolic, it is a testament to our collective commitment to addressing urological care across the SAARC region. As we convene to discuss the urological aspects that unite us, let us delve into the commonalities in urological diseases prevalent in our geographically diverse yet interconnected nations. Urinary stones, prostate disorders, urinary tract infections, emergencies, shared challenges along within the SAARC countries. Geographical proximity, socioeconomic factors contribute to the similarity in disease patterns. Recognizing these commonalities, we must foster collaboration to develop standardized approaches to diagnosis, treatment, and prevention. The management of urinary stone, a pervasive issue across our region, demands a united effort. By sharing expertise and resources, we can enhance treatment modalities and preventive strategies. Establishing regional guidelines for the diagnosis and management of stones will ensure a consistent and effective approach optimizing patient care. Prostate disorders, particularly benign prostatic hyperplasia, affect a significant population of our aging male. Collaborative initiative in research and sharing best practices can lead to advancements in the management of BPH. Furthermore, promoting awareness about regular screening and early detection will contribute to reducing the morbidity associated with prostate cancer. Urinary tract infections, a common urological ailment, necessitate joint efforts to establish evidence-based protocols for treatment and prevention. By working together, we can address challenges such as antibiotic resistance and ensure that our population receive optimal care. Shedding the light on the oncological aspects of urology, we must acknowledge the rising burden of urological cancers in our region. Collaborative research endeavors, joint tumor boards, and the exchange of clinical insights can contribute to improved outcome for patients with urological malignancies. Through joint efforts, we can establish regional cancer registries to better understand the epidemiology of urological cancers, facilitating targeted interventions and advancement in treatment modalities. The creation of a regional database on urological diseases would facilitate a deeper understanding of prevalence, contributing factor in treatment outcomes, ultimately guiding us towards new effective interventions. I would also like to divert everyone's attention in envisioning the creation of guidelines on urological malignancy and other diseases common to our region. Reconstructive urology, a crucial facet of our discipline, requires a collaborative approach for the exchange of knowledge and expertise. By sharing advancement in reconstructive techniques, we can collectively enhance the quality of life for patients requiring urological reconstruction. Furthermore, the establishment of telemedicine networks can provide a platform for urologists in our region to consult with their counterparts, share expertise, and discuss complex cases. This virtual collaboration can transcend geographical boundaries and ensure that even the most remote areas have access to specialist urological care. In nurturing the future of urology, it is imperative that we engage residents and young urologists in our collaborative efforts, establishing forums for knowledge exchange, mentorship programs, and research collaborations will empower the next generation of urologists, ensuring a seamless transfer of expertise and fostering innovation. As we envision the future, let us commit to bridging a robust network of cooperation amongst our countries in urological research, education, and patient care. By leveraging our collective strength, we can overcome challenges, elevate standard of care, and concentrate to the treatment of betterment of the urological health across our region. In conclusion, I extend my sincere gratitude to the organizers, the people, and the Sri Lankan Urological Association again for their warm hospitality. May this conference be a catalyst for enduring collaboration and advancement in urological care across the countries. Thank you. Long live SAUS. Together, we move forward. Thank you all.
It is now my pleasure to introduce Professor Muhammad Ayaz Khan, the President of the Pakistan Association of Urological Surgeons.
Good evening, everybody. First of all, I'm very thankful to the Sri Lankan Urological Association for giving us this opportunity to sit together, had socialization, shared our knowledge with each other, and had a very good time. Ladies and gentlemen of this esteemed gathering, allow me to extend my warmest salutation to each distinguished individual gracing this occasion with their presence. I am profoundly privileged to represent PAUS Pakistan on this global stage. I extend my heartfelt appreciation to all those who have contributed to the success of SAUS and SLAUS. And I express my sincere gratitude to each one of you for your unwavering support of our shared mission. The partnership between the SAUS and the PAUS is a testament to the incredible chemistry and unbreakable bond that we share. It is a shining example of how two organizations, when united by a common purpose, can achieve extraordinary feats. As we look to the future, let us recognize that by continuing to work together in a spirit of continuity, we can take our ideas and initiatives to even greater heights through the power of our unity. The benefits of our collaborations are multifaceted. Firstly, our unity allows us to pool our resources and expertise, thereby amplifying the impact of our efforts. This synergy is invaluable as it enables us to tackle the complex challenges that neither of us could address individually. The collective strength of PAUS and SAUS opens doors to new opportunities and possibilities that can have a lasting positive effects on our respective regions. Moreover, our partnership provides a unique platform for research and innovation. By combining our intellectual resources and creating a conducive environment for knowledge exchange, we can foster groundbreaking research initiatives that have the potential to address pressing global issues. Our collaboration can become a hub for interdisciplinary research, fostering creativity and innovation in a multitude of fields, from healthcare and technology to environmental sustainability and socio-economic development. Furthermore, our unity is a beacon of hope and inspiration for the broader international community by demonstrating that collaboration and cooperation can transcend borders and cultural differences. We set a powerful example for others to follow. Our efforts can serve as a model for global diplomacy, showing that through dialogue, understanding, and shared goals, nations and organizations can come together for the betterment of humanity. In conclusion, the partnership between PAUS and the SAUS is not just a collaboration, it is a testament to the potential that lies in unity and shared purpose. As we move towards, let us continue to harness the power of our chemistry and work tirelessly to expand our horizon. By doing so, we can shape a brighter, more interconnected future where our collaborative endeavors make a meaningful difference in the world. Together, we shall continue to make strides in the field of urology and elevate our collaborative efforts to even greater heights. Thank you for your attention, for being part of this momentous journey. Thank you.
Up next, please join me in welcoming Dr. Sanjay Balwant Kulkarni, the President of the Urological Society of India.
Good evening, dignitaries in the dais. I bring greetings from 5,500 members of Urology Society of India to this August gathering. Because of my interest in urethroplasty and laparoscopy, I have visited almost all countries that we represent in SAUS today. I have been to Pakistan twice, to Bangladesh, to Nepal, and Sri Lanka also. So once, about 10 years ago, I was invited to Bhutan. And there was a young urologist who picked me at the airport, took me to the hotel. My wife was with me. And for next 5 days, we used to do, he used to collect me at 8 o'clock from the hotel, go to the hospital, and do urethroplasties together. And then today, he is the Prime Minister, Dr. Lote. So this journey of traveling to different countries had brought a lot of friends around the world here. So I met a friend from Bangladesh, and he told me about a complex posterior urethroplasty which had failed. The patient had bulbar necrosis, and he is circumcised. So this is more technical, and then he could not use the preputial skin which we use for urethroplasty. So he used the scrotal skin, and the most important, he told me that he used the Shah's penile prosthesis, which is developed by Rupin Shah from India, and the cost of the device in India is about $200. So innovation in one part of the SAUS countries could be useful in another part. And this is a very simple device, and it is very popular in India, and I'm happy that it is popular in Bangladesh and other countries also. So I thank Dr. Madhu Agarwal and his team for starting this new society, SAUS, and we had a council meeting today, and the next meeting is going to be in Bangladesh, and after that we will go to Nepal. So making friendships around India and in SAARC countries here is very important for all of us because our disease pattern is same, our economic problems are same, and we have the similar kind of solutions which we can discuss and share with each other. So I thank the organizers for inviting us today and wish you a good meeting. Thank you very much.
Thank you very much, sir. And with that cue, I'd like to invite onto the stage once again now the immediate past president of the Urological Society of Australia and New Zealand. Ladies and gentlemen, please welcome Dr. David Winkle.
President Manjula Wijiwadena, distinguished guests, ladies and gentlemen, old friends and new friends. It's a great pleasure to be here this evening and over the past few days to represent the Urological Association of Australia and New Zealand, or Urological Society of Australia and New Zealand. It's also a great pleasure to be the past president of the Urological Association of Asia which allowed me to meet many friends, including Kalana. And I thank him for inviting me to this meeting when I met him in Chicago earlier in the year. I'm not sure the people from WhatsApp will know what hit them when they see the amount of use it's had in the last few days. Australia and New Zealand have a rich history with Sri Lanka. There's a large Sri Lankan diaspora in both countries, and they've added greatly to our countries. I'm very grateful that we can contribute to this meeting and to the to SLAUS, and I look forward to enjoying the organisation SAUS, which seems to me to be an extremely important organisation for this part of the world, just as Sanjay has just espoused. Once again, many thanks for the invitation. Greetings from Australia and New Zealand. We're very grateful and we're honoured to be friends and colleagues. Thanks very much.
Thank you very much, Dr. Winkle, for those wise words. And now we move on to welcoming the President of the SARC Association of Urological Surgeons, Professor Madhusudan Agrawal, to address the gathering.
All the dignitaries and my friends, after what has already been said, I don't think there's much for me to repeat, except expressing my heartfelt appreciation and deepest gratitude to Sri Lanka Association of Urological Surgeons, the organizing team led by Drs. Manjula and Kalana, their unbound energy and enthusiasm, and such a wonderful meeting that we have had all day today, and we are going to have tomorrow. Sri Lanka is a favorite for almost everybody, and for me it's like a second home. I've been here so many times, I've lost count. Under the presidency, all the pictures which Manjula was showing, it kind of brought back memories, very nostalgic for me, because I've been here under the presidency of almost every one of them whose pictures he was showing. And we've done so many workshops together and so many programs together. And one memorable event that I can never forget is the dinner that we had on the beach side. And we had Neville sing a Hindi song, such beautifully and perfect rendition. And later he told us that he doesn't understand a word of Hindi. So we have had such wonderful time here, and every time the hospitality from Sri Lanka is perfect. And you'd be happy to know that all the people who we are able to bring for this SARC Congress, at least half of them have said that they'll come back again with the families to enjoy this island country once again. So thank you very much for this opportunity and to bring this family together. The bond that we share is unbreakable. It's a wonderful family that we have, and we are all part of this family. And to be able to interact with each other and with all the dignitaries who have been invited here, it's an excellent opportunity and a memorable time that we have had here. So thank you very much.
Please join me in welcoming giving a warm welcome, of course, to the President of the Urological Association of Asia, Dr. Yasser Farahat, to speak to all of you.
Good evening, ladies and gentlemen. Actually, it should be prepared presentation. I should come with some slides or some written, but actually I prefer to be spontaneous talk from heart to heart. But surprisingly, I will not say thank you to the Sri Lankan Urological Association for inviting me. I will say thank you so much for the privilege that you offered to me to be with you, for the opportunity to see in reality what capabilities they have. I consider today it's a new chapter for Sri Lankan Urological Association. A new chapter, not in the content only, not in the caliber of the speaker, not in the organization. I can say a new chapter of leadership. Leadership, how small society can work with dedication, with motivation, with enthusiasm to do a big event. A leadership to join with a regional organization like SARC. Leadership to be an active member in a big international society. Leadership in building relationship and recognition with the international society, having keynote speakers from all over the world here. So really, thank you so much. I really impressed. I came not expecting to have this wonderful event with this caliber, but really, I respect and admire what I had done today. I really appreciate and thank you for everything you did. It's really amazing job, and have a wonderful evening and the rest of the conference. Thank you.